Community Reach Center has been helping children, adults, and families overcome the most critical emotional challenges of their lives since 1957. The following stories are a glimpse of how the center has provided supportive mental health care to these individuals and our community.
We provide services annually to over 7,000 individuals in Adams County. People don't come to us when they're feeling good. They come to us when their lives are coming apart.
My granddaughter, she was 5, and she was not equipped to handle social interactions. She didn't speak. She was very clingy, and she just had a hard time with her emotions, and she was very blank quite often.
When I started treating Marie at Community Reach Center, some of her symptoms were high anxiety, and she wouldn't speak at all. We would rock babies in silence for 3 months about. It was a long time, and I wasn't allowed to talk. She shushed me. She was in charge, and in this room, the child is in control. You want brown here or here?
Inside.
Inside, okay, I can do that. Psychotherapy is not effective with children. What is very effective is play therapy. And a lot of the abuse and trauma happened before they were able to speak. So through play is a way that kids can repeat themes and correct themes and work out a lot of the issues through the play. What do you want me to do with these guys? You're not sure.
Put them over there.
Put them over there, one by one or all together?
All together.
All together. Are they having fun?
Yeah.
They don't have words, but we can talk about the feelings when things happen. We also can utilize and instill some positive social skills, which are very important too when they're about to go into Head Start or kindergarten on their way to the school-based community.
I'm very blessed with my resources. And so now bringing Marie is basically like going to a lesson that this is just what we do. This is just what we need to do to keep our lives in balance.
Marie has grown in so many different ways. She's developed her own sense of humor. She has been talking and sharing and communicating with her brother and grandma and all her friends. She has 2 best friends now, and that's big in terms of resiliency and being able to do well further on. I mean, this kid early on, she said nothing. And now she's just blossomed, and she's a really, really special girl. And other people see it too, not just me.
People look at individuals with mental illness and they don't see an illness. They don't see a disability. They don't have a visible handicap that people can automatically assume that there's something going on.
I was horribly abused as a child. And as a result of that, and probably some genetics, I started having symptoms right after my parents died, within days. I wanted to over-medicate to get away from the pain and the feelings and all of that. And I was a cutter. I used to cut myself, and that was a really hard thing for my kids to deal with. I also overdosed numerous times, and that was a hard thing for my kids to deal with. My motivation was gone, and my want to die was big. My diagnosis is major depression, borderline personality disorder, and post-traumatic stress disorder. I've been with Community Reach Center now for about 14 years. I have been lucky enough to have the same therapist. Her name is Susan Anschutz. She's really a great therapist.
For many people who have had nothing but hardship in their life, it's hard to imagine having productive, satisfying relationships or life without suicide attempts or danger or brutality. And therapy is a way to help people begin to put pieces in place that will substitute for all the drama and all the negative stuff.
Gloria is now employed full-time with Behavioral Health Incorporated as the program director of the Rainbow Center, a gathering place for consumers from 3 community mental health centers.
So I think I'm really looking forward to that. And she said
all of this recovery has led me to the place where I can encourage other people in their recovery. I think everybody is capable of recovery.
My diagnosis is bipolar 1 with some, there's some schizophrenia involved and some psychosis. A couple of years ago, was very homicidal. I learned that drinking helped relieve a lot of the symptoms. So over the years, I did become an alcoholic, medicating myself. When I was 19 years old, was my first hospitalization. I've had 9 hospitalizations since then. I'm 65 now. When I'd go in the hospital, they would say, well, you're an alcoholic, and then they would turn me loose. But I wasn't getting any help for the mental illness. Once I learned what the diagnosis was and that it was treatable, it was like a load lifted off my shoulders. I see Dr. Wade Marklin, who really helped me a lot to understand what was happening in my brain.
Understanding mental illness, understanding how the brain works and doesn't work is very important because I think it improves people knowing about themselves, it improves patient compliance with medications, and it gives them a sense that what they have is something organic, biologic, not different from cardiovascular disease, liver problems, anything like that. The brain is just another organ.
I'm more stable now than I've been in years, and that's really a miracle.
Community Reach Center operates the largest school-based therapy program in Colorado and is currently serving approximately 1,000 students.
I see a need for school-based therapy in every school because you're going to have kids with mental health issues and they're going to need support. A lot of times they come to us because of behavior problems in the school or behavior problems at home. Sometimes those look like, attention deficit hyperactivity disorder to severe depression. You really see the whole gamut here.
One of the wonderful things, and it's part of having it on site, is that Heather helps kids do their school business in a very healthy, productive way.
A lot of the therapy that I do is play therapy, and then a lot of family therapy on top of that. I work with probably about 90% of my parents very often, probably at least once a month. I have them come in and have family therapy with the kids and the parents included.
The advantage is that that mental health therapist is on site. So when the child is in a crisis, that person is here for the child.
I've had a lot of kids threaten suicide and truly feel like they want to die, even at the young age of, kindergarten through 5th grade.
We had a 5th grade boy who was suicidal. He'd had 4 family members who had been successful in killing themselves, so we knew he had the means.
When we had to have the police come, he was running away from school and said he was going to kill himself and leave school, and just unfortunately he couldn't be safe with himself, and he did have to go to the hospital.
Monday we got the school-based therapist involved.
He was really able to work on some of those feelings of feeling responsible for his whole family and for everything that had ever gone wrong in his family.
Our school-based therapist worked with Mom and the older boy and Grandma.
And so once he was able to really work through a lot of that, you would just see this kid just shining some days, a huge smile on his face.
Gosh, I just can't say enough wonderful things about Heather. Kids like to be with her, parents feel comfortable with her, and staff, we don't know what we would do without her. In this program, it all does work together for the good of our kids.
Without them and all these programs and things, I don't think I would be, I know I wouldn't be here.
They're all caring people, and you can tell they're caring. They saved my life.
People are very sincere about being helpful here, and I don't know what Marie would do without Community Reach Center.
From the youngest child to the most senior citizen, whether it's a few sessions to work through a difficult episode in your life or ongoing treatment to support recovery from a persistent mental illness, the Community Reach Center is all about changing lives for the better, with the right treatment in the best setting when it matters most.